Many studies about a link between hormones and breast cancer risks have been released. Hormones are still used to treat menopause, but some studies say it increases your risk for other health issues. So what is the real deal? Well, here to help cut through all the confusion is Dr. Michelle Warren, the medical director of the Center for Menopause, Hormonal Disorders, and Women's Health. Dr. Warren, great to see you. Thanks for being here.
Oh, thank you.
So there is this recent study that has come out. We discussed it a little earlier on the show as well, that shows a link between hormone therapy and a deadlier form of breast cancer. Tell us a little bit about this study and your take on the study.
Okay, well, this is an extension of the original study that was done, and the incidence of breast cancer hasn't changed. It's the same. It's about 8 per 10,000 women. What's different about this is that they went and studied the women for a longer period of time, up to 11 years, and they looked at the women who developed breast cancer, and they found that there was an increased death rate in that group versus the ones who got breast cancer and didn't take hormones.
Right.
But the incidence is very tiny. It's about 1 extra patient per 10,000 women. So it's a tiny increase. The problem is that it came out with numbers that confused everybody, because it was 2.6 women per 10,000 that got breast cancer and died versus 1.3 that got breast cancer and died but didn't take hormones. So you have to look at the denominator. It's a tiny number.
When they say the risk or the number doubled, it sounds very frightening, but when you look at the numbers, it's not quite as shocking.
That's right. They said doubled, but
right.
when you look at the denominator, it's a tiny number, much less than 1%.
Ah, okay. And this group of women also was not very healthy, is that right?
Well, the women were different in that this study, which is quoted a lot, they gave hormones to women who were much older. Okay. The average age was 65. But in addition, they weren't very healthy. Unfortunately, women in the United States that they studied, average age of 65, were overweight. A third of them had high blood pressure, and 50% of them had been smokers or were smoking. So if you're unhealthy and you get breast cancer, you're more apt to die.
Right.
So it certainly makes sense.
And so this is a pool of women that probably would not be good candidates for hormone therapy.
That's
correct?
right. I mean, if I'm in my office and I'm looking at a patient who's smoking and overweight, I'd think twice about giving her hormones.
Right.
If she's very symptomatic, they have a lot of symptoms, we figure out a way to give a very low dose.
Right. So let's break this down, because for so many women this can be confusing. We're looking at women who have menopausal symptoms, which first of all you can explain to us what they are, and they have very few options, correct?
Yeah, that's true. I mean, the menopause symptoms when they occur can be devastating. They include very severe hot flashes, insomnia, sometimes depression, moodiness, and as a result, some women really need some help through that transition. How you treat it, generally the only thing that's available that really works well for all of the symptoms are hormones.
Right. And so who are the best candidates? Who is a good candidate for hormone therapy, and who should not take hormones?
Well, actually the greatest risk is getting a clot, a venous clot that can go to the lungs, and that's dangerous. So we don't like to treat women who have a history of clots in their family, or women who are very overweight, and in fact women who are smokers. And we certainly don't start hormones at 65.
Right.
We start it right at 50 when most women are having symptoms.
For a limited period, or is it unlimited?
Well, you know, it's never forever. What I tell my patients, it's 2 to 5 years on the average. Now, some patients go on for a longer period of time because they continue to have symptoms. Right.
Now, it's important to also point out that the study only applies to certain types of hormones. Is that correct?
Yeah, that's very important. It applies to women who take estrogen plus progesterone, and not to estrogen alone. Okay. So you take estrogen plus progesterone if you have a uterus, because it prevents the lining of the uterus from overgrowing.
Okay, now what can a woman do who is on hormone therapy to reduce her risk of unwanted health side effects?
Okay, so I think it's very important to keep your weight down, to stay healthy, to exercise. There is evidence that pre-diabetic issues like insulin resistance will increase your risk for heart disease, stroke, breast cancer. So if you can keep your weight down and exercise, and I tell my patients, exercise even if you don't lose weight, because it helps the body.
Right.
It helps the body with pre-diabetic issues.
And so, Dr. Warren, the bottom line here is that hormone therapy will still continue to be prescribed for the ideal candidates. Is that right?
Yes, I think hormones are very useful for women who have symptoms, and in our offices we are looking at risk versus benefit, and for some women this is the best treatment.
Right.
And over a period of time, if you don't have, if you notice that your symptoms decrease, you can start tapering the hormones, and we recommend using the lowest dose that controls symptoms.
Thank you so much, Dr. Warren, for shedding light on this confusing issue. Confusing for a lot of women. And for more of the latest medical news, be sure to log on to the health page at abcnews.com.